Pregnancy Wonders 3D, an educational channel about reproductive health and pregnancy. Subscribe to explore medicine with us and write in the comments what else you'd like to learn.
Why your pregnancy test shows different results. Have you ever taken multiple pregnancy tests only to get completely different results? One shows positive, another negative, and you're left wondering which one to trust. This confusing situation happens to thousands of women across the United States and Canada every single day. And there are specific medical reasons why pregnancy tests can give you conflicting results. Today, we'll explore the science behind pregnancy test accuracy, examine the factors that cause inconsistent results, and help you understand when to trust your test and when to seek medical confirmation. Section 1. How pregnancy tests work. Before we dive into why tests show different results, let's understand how pregnancy tests actually work. All home pregnancy tests detect a hormone called human chorionic gonadotropin, or HCG, in your urine. This hormone is produced by the developing placenta after a fertilized egg implants in your uterus. The key factor here is timing. HCG levels start very low and double approximately every 48 to 72 hours during early pregnancy. This rapid change in hormone levels is the primary reason why you might get different results when testing multiple times. Most over-the-counter pregnancy tests sold in the United States and Canada can detect HCG levels as low as 25 milli-international units per milliliter. However, some tests are more sensitive than others, which explains why different brands might give you different results on the same day. Section 2. Timing and hormone fluctuations. The most common reason for conflicting pregnancy test results is testing too early. If you test before your missed period, your HCG levels might be too low for some tests to detect, but high enough for more sensitive tests to pick up. Let's look at typical HCG progression. At implantation, which occurs about 6 to 12 days after conception, HCG levels are often below 5 milli-international units per milliliter. By the time of your expected period, levels typically range from 25 to 100 milli-international units per milliliter. This means if you test with a less sensitive test early in pregnancy, you might get a negative result. But if you use a more sensitive test or wait a few more days, the same pregnancy could produce a positive result. Section 3. Test quality and user error. Not all pregnancy tests are created equal. Tests sold in pharmacies across the United States and Canada must meet FDA approval standards, but their sensitivity levels can vary significantly between brands and even between batches of the same brand. Expired tests are another major factor. Pregnancy tests have expiration dates for a reason. The chemical components that detect HCG can break down over time, leading to false negatives or even false positives. User error also plays a significant role. Reading results outside the recommended time window, using diluted urine, or not following package instructions can all lead to inaccurate results. The most accurate results come from using first morning urine, which contains the highest concentration of HCG. Section 4. Medical conditions affecting results. Several medical conditions can cause pregnancy tests to show conflicting or inaccurate results. Chemical pregnancies, which affect up to 75% of very early pregnancies, occur when an embryo implants but stops developing within the first few weeks. During a chemical pregnancy, HCG levels rise initially, causing a positive test result, but then drop rapidly as the pregnancy fails to progress. This can result in a positive test followed by negative tests just days later. Certain medications can also interfere with test results. Fertility treatments containing HCG, some antidepressants, and medications for Parkinson's disease can cause false positive results. Medical conditions such as ovarian cysts, kidney disease, And certain types of cancer can also affect HCG levels, though these situations are relatively rare. Section 5. When to seek medical confirmation. If you're getting conflicting results from home pregnancy tests, the most reliable next step is to consult with a healthcare provider. Blood tests can measure exact HCG levels and provide definitive answers about pregnancy status. Healthcare providers in the United States and Canada typically use two types of blood tests. Qualitative blood tests simply detect whether HCG is present, while quantitative blood tests measure the exact amount of HCG in your bloodstream. Quantitative blood tests are particularly useful because they can track whether HCG levels are rising appropriately for a healthy pregnancy or declining, which might indicate a chemical pregnancy or other complications. Conclusion: understanding why pregnancy tests show different results can help reduce anxiety and confusion during what's already an emotionally charged time. Remember that home pregnancy tests are screening tools, not diagnostic tests. If you're trying to conceive or suspect you might be pregnant, the most important thing is to work with a qualified healthcare provider who can guide you through the process and provide accurate, personalized medical advice. For more medically accurate pregnancy education with detailed 3D visualizations, subscribe to our channel and turn on notifications so you never miss our latest content.